Well, the environment we live in is actually quite concerning as it relates to our health and well-being, and especially cancer. More so, the risk of developing cancer in the first place. We live in a world that's awash with different chemicals, everything that we can be exposed to through the air, through water, and then of course through things that we put on or in our bodies, on meaning, personal care products, and of course in our bodies, things that we eat. We think about this whole area in terms of the types of toxins, and things generally fall into two different categories as it relates to cancer. Things that are known carcinogens, so a substance, a chemical that we know causes cancer in and of itself, formaldehyde being an example, asbestos, benzene. These are substances that we know change and damage cells. And so then when those cells replicate, they're replicating in a mutated form. They grow out of control. And of course, that's what we call cancer, abnormal cells growing out of control. The more insidious and challenging area are chemicals that fall into this class that are called endocrine disruptors. So these are chemicals that we're exposed to every day that modify how our endocrine system works, modifies how our hormones are functioning. And there are many cancers: prostate cancer, breast cancer, ovarian cancer, endometrial cancer, and more, that are actually linked with abnormalities in hormonal function. And these exposures are happening in utero, really from the time of conception of the fetus. When a child is born, there's evidence from analyzing the umbilical cord blood that there are hundreds of chemicals that the baby was awash in. And so doing whatever we can to clean up what we are in control of is just critically important.